were in New Rochelle. It began when a single local resident, a lawyer who worked in Manhattan, commuted in and out of Manhattan, contracted the virus. And then he seems to have passed it on to his own family members, and then they passed it on to others. Within a week of that first one case of COVID-19 being discovered in New Rochelle, within a week, the number of known cases there had spiked to over 100. That led Governor Andrew Cuomo to announce back on March 10th the establishment of an unprecedented 1-mile containment zone in New Rochelle. Schools, places of worship, all major gathering spots were closed. National Guard was sent in to deliver food and also to clean the area. It was the first effort of its kind in the U.S. to try to slow the spread of the virus by keeping people in their homes and keeping people from going out. That decision in New Rochelle to institute those early social distancing measures maybe appears to have started paying off. The latest numbers from New Rochelle show that 2 weeks after those measures were put into place, the spread in that city is starting to slow. And it's a bit of a controlled experiment here, because while New Rochelle was subjected to those measures on March 10th, the rest of Westchester County only instituted similar measures last week when those measures went into effect statewide. In the county as a whole, the number of cases continues to rise unabated in a way that we are no longer seeing in New Rochelle specifically. Apparently because New Rochelle specifically acted, and it made a difference. These rules appear to make a difference. Joining us now is Westchester County Executive George Latimer. Mr. Latimer, thanks very much for being with us. Let me start by asking if I got anything wrong there, if I said anything that seems wrong-headed to you about the situation in your county and with New Rochelle.
No, I think, Rachel, you really summarized it very well. It's still a story in progress, but we're encouraged by what we've seen so far.
I do know that the number of cases in your county continue to rise, but you do have what appears to be a success story in New Rochelle, where the numbers, the rise each day really seems to have almost come to a halt. Is there something specific about what New Rochelle did which is not being done statewide and therefore in the rest of the county right now? Is there something else that we should be learning in terms of public policy from New Rochelle's experience?
Well, I think the shutdown that happened in New Rochelle, and credit Governor Cuomo for advancing this in the 1-mile radius in the north end of New Rochelle, was really seen as very severe at the time. But it jarred people into realizing that this was a very serious contagion that was moving around rapidly. And as you point out, in the first really few days, we jumped up to 100 cases in New Rochelle. Now, over the last 2 weeks in that vicinity, we've done just about the same number of cases, slightly more. And in the last 3 days, we've had 3 cases. I don't know what the trend lines will show in the future. This is a very hard thing to predict. But what we saw in shutting down the schools, a couple of country clubs in that area, houses of worship, the religious services were shut down in both Christian and Jewish faiths in that area. It stopped people from congregating, and it stopped people apparently from spreading the virus so quickly. The fact that there still is a spread is there. But certainly, as we look at overall in Westchester County, we've tested with more cases per capita than any other county in the country. But we're hoping that what we're watching is the beginning of what we hope is this flattening of the curve that will save us in the long run, if it's accurate and if it's across the board.
In terms of that large number of cases that you've done per capita in your county and the large number of cases you've had, I know that you asked for volunteers to come forward to help healthcare workers, help support the healthcare system in your county. I understand quite a number of people have come forward, and some of them have started to be deployed today to work with the Department of Health. What are you asking people to do as volunteers? How's that going?
Well, so far in making this general, calling all nurses, calling our doctors and other people who have experience in the healthcare field, we've gotten over 120 responses, 90 plus nurses, 20 or so doctors. And we know that when we hit the surge, and Governor Cuomo indicated that we expect New York to be on the front end of the surge, possibly in the next 2 weeks, maybe less, maybe slightly more, we're going to need all the nurses we can get. We're going to need all the doctors we can get. We've taken a facility in Westchester County that we use for basketball tournaments and sporting events and exhibits, and we're prepared to turn it into an additional temporary hospital for overflow to buttress the 3,000 hospital beds that we normally have in Westchester County, and trying to get the service personnel that can administer this along with the physical space is essential. Your earlier story about having the PPEs is essential as well. All of the equipment that we need. And of course, we need ventilators. We need things that we in the local government can't provide. But I think this is an example of being prepared in advance. And if we can do the right things, hopefully we can keep this from peaking at the highest possible levels and save ourselves some of the tragedy we've seen in Europe and in Asia.
George Latimer, Westchester County Executive. Sir, I know this is a trying time. Thanks for making time to help us understand it. I really appreciate it. Thank you.
Thank you, Rachel.
All right. We'll be right back.